My name is William Kelly. I'm an assistant professor in hematology and oncology at the Mays Cancer Center at UT Health San Antonio. Glioblastoma is the most common and unfortunately aggressive form of brain tumors. It has an average survival, even after surgery, radiation, and chemotherapy, of only about 14 months. We can extend that a little bit using something called tumor treating fields, but it still remains a very devastating disease for these patients. So the drug's name is sacituzumab. It's a novel type of drug therapy called an antibody-drug conjugate. And what that means is that it has an antibody which targets a specific protein on the tumor cell. So almost like a homing missile. And the antibody carries on it little bits of chemotherapy to directly deliver that chemotherapy to the tumor cell, thereby sparing normal cells. What's kind of most exciting about sacituzumab govitecan is that it is a drug that's already FDA approved with multiple positive studies behind it in patients with urothelial cancer and triple-negative breast cancer. So we know that the drug works. And the next question that comes naturally is, does it work in glioblastoma? So this research is based on a phase 0 that was conducted by my mentor, Dr. Andrew Brenner. What a phase 0 is, it's a very limited study looking at a small group of patients. He had conducted a study looking at patients with breast cancer and brain tumors, and we had seen some positive data from that. So the next step is to bring it into a much larger group of people and really confirm safety and also look for what we call signals of efficacy, meaning does the drug do what we want it to do? We all have either through ourselves or through a loved one dealt with cancer. And those moments are very trying. And to me, it gives me a little bit of comfort if when that happens to either myself or a loved one, I know that there are options for them. And CPRIT allows for expanding those options, not only directly through clinical trials, but for all the patients down the line who would benefit if the drug was found to be successful and FDA approved. So let me state unequivocally, this research would not be possible without CPRIT. It pays for the ability to see these patients, to get imaging, to treat them, and it changes people's lives.